It's another busy morning as pet owners and their cherished animals head to the clinic for routine checkups and procedures.
Yeah, going to vets. Yes, we are.
The day's first patient is Rory, an 8-year-old Golden Retriever.
Hiya.
Hi, Barry. Do you want to come on in with Rory?
Come on. There we go. Come on in here.
Come on in.
He can't wait.
Here he is. Hello. So it's his eye that you're worried about with the little
Yeah,
lump on his
certainly.
eye?
Yeah. The growth came up quite quickly, so I was worried about just how big it's going to get.
Yeah, definitely better off sooner rather than later with an eyelid. So our plan today is to remove that. So we take a little wedge, so a little triangular wedge to include the lump, and we'll send the little lump off to be analysed by the histologist to make sure that it's just an eyelid wart and nothing more.
I take it he'll have the cone on.
Yes, unfortunately.
How long is the cone on for?
So about 7 to 10 days. That's probably going to be the worst bit of the whole thing, I think, the cone. Perfect.
So I leave him with you now?
That's all right. Yeah, that'd be
Right.
great. I'll go and get him settled into a kennel.
Bye-bye.
He's in good hands.
Ta-da, mate. I'll see you soon.
The nursing team prepares Rory for surgery, administering his pre-meds. Golden Retrievers are more prone to inherited eye conditions like cataracts and progressive retinal atrophy, and can also develop eyelid issues, so regular vet eye checks are important. As the medication takes effect, he's carried to the prep area for surgery.
So Amy is doing the operation and Beth assisting.
Yes, I'll be monitoring his anaesthetic, making sure he's doing well under anaesthesia.
How long is the procedure, Amy?
Probably about 20 minutes, half an hour.
Oh, good. Well
Yeah.
done.
It's a delicate operation. It should be straightforward. So we take a little wedge of tissue, like a little triangular wedge of the eyelid margin that includes the lump. So we basically chop that out and then suture the eyelid back together. Just being really careful to make sure that the eyelid margin is confluent with itself and without a step.
Confluent, did you say?
Yeah. So
That's a great word. What does that mean?
I hope I've used the right word there. So that it, so there's no step in the eyelid
Oh, I
margin.
see. So matching up perfectly.
Yeah, exactly.
And is it something that's serious or nothing to worry about?
So I actually don't know yet. It's difficult to say for sure what the lump is just by the way that it looks. So we will send the lump off for some histology. So the histologist will look at the cells that make up the lump and tell us exactly what it is.
Good boy. Right, here we go. Yes, this is the shaving round his
Yeah.
eyelid.
You obviously have to be quite careful not to damage the eye itself.
Once the eyelid and the surrounding area are prepared, it's time to move Rory into the operating theatre.
He's a lovely boy, isn't he?
Before Amy can proceed, she needs to scrub up. This rigorous process prevents bacteria from entering Rory's surgical wound.
Just pick the wrong hand.
Great, so that's the eyelid mass there. You happy if I cut?
And with that, Amy makes the first incision.
Such delicate work. Is this the triangular cuts that you're doing?
Yeah.
And here it comes. Done.
Okay, so that's the eyelid mass.
That's going to go into formalin solution.
And off to the laboratory.
Yeah.
And fingers crossed it comes back benign.
Hopefully, that's what we'd all hope for.
Once tested, the results will be ready in 10 to 14 days.
Is this a different kind of stitching for this sort of operation?
So it's slightly different. There's just a couple of things that we need to bear in mind. So we need to make sure that the suture material stays within the eyelid itself. It doesn't go all the way through to the other side of the eyelid, where it could potentially rub on the eye surface. And then we want to make sure that any knots that we tie are away from the eyelid margin as well.
It's like trying to do then perhaps stitching a hem, so you stitch it so that you cannot see it from the outside.
Yes.
But this is the other way, you can't see it from the inside.
Obviously, any defect in the eyelid margin will mean that the eyelids won't work very well as like windscreen washers across the surface of the eye to distribute tears and the tear film. And so you see how the eyelid is in line with each other. There's no big step. All the sutures are away from the eyelid margin here rather than up at the top. And yeah, obviously they're dissolvable sutures, so they should just fall away in the next couple of weeks, really. So yeah, we're done.
Brilliant.
Happy with that?
Well done. How long did that take, Beth?
15 minutes.
Yeah, quite quick.
Not that you're racing, but that was just...
it's nice and straightforward.
Yeah.
So yeah.
The next patient to enter the clinic today is Tokyo the cat, whose owner, Renee, has booked an appointment following a hunch. She's being checked in by student nurse Leah.
Hi Renee, have we got Tokyo?
Yes.
Lovely, come on in.
After a recent dental lecture on feline teeth, she began to suspect something wasn't quite right with Tokyo.
How's he been today?
Yeah, he's good.
Bet it was a bit of a shock he didn't get his breakfast, bless him.
Oh yeah, he wasn't happy at all.
Hello Tokyo. How did you come to know about Tokyo's tooth?
Yeah, so I was in a vet lecture and it was a dental lecture and they were telling me that sometimes cats can eat grass because they've got like inflamed teeth or they're feeling some
You're a
pain
vet
there.
student.
Yeah,
Oh wow, that's great.
Yeah, so when I heard that, I kind of thought, oh, that's Tokyo's favourite thing to do, sort of go outside and eat grass. He sometimes doesn't let me in his mouth, which I thought was a bit weird. So I thought I'd come see James, see if anything was going on, and then James confirmed that he had a fractured tooth.
Oh wow,
Yeah.
how clever.
Yeah.
Well no, it's good that you were sort of in that lecture then, isn't
Yeah,
it?
no-
Even I didn't know that, so no, that's great to know. So what I'm gonna do now, I'll just get him settled in our little cattery area. All right.
Yeah, perfect.
Fab, no worries, mister.
James, with his special interest in dentistry, will be attending to Tokyo today.
That's the tooth. Got this wobbly tooth. The question is whether there's a problem with the roots there. Has the tooth broken? Have the roots reabsorbed? So we're going to get him asleep because he's going to need an anaesthetic, and I'm going to X-ray the tooth to start with. X-rays.
James needs to capture dental views of Tokyo's teeth, something the main wall-mounted X-ray machine can't provide. Instead, he's using a handheld X-ray gun to achieve a precise bisecting view of the teeth. For safety, James wears a protective lead gown and goggles to shield against any scattered radiation.
It is a bit of a head scratcher why this one tooth has done what it's done. If the tooth has actually fractured and we've got two root remnants left behind sitting still in his jaw and in his bone, then that's going to be a bit more complicated. So the good news is, rather than this being a tooth fracture, this to me looks like a resorbing lesion. So what's happened is the roots have turned to bone, and as a result, the crown has then sort of essentially kind of fractured off and has been sort of displaced forwards, which is why it's sitting there looking wobbly, but there actually aren't any roots there for me to take out. So the good news is I can just literally take that crown away.
Now that James has the complete picture, he gets to work to remove the fractured crown.
It's that one tooth that's been causing him the trouble. We've now sorted that out. So I'm hoping he's going to be a lot more comfortable really quite quickly after today.
Tokyo. Does your mouth feel weird? I'm sorry.
While Tokyo recuperates and recovery, Beth and I see how Rory is getting on.
Who's been a good boy?
Oh, Rory, come on.
Come and say hello.
After going under the scalpel, he's more than earned his breakfast.
Second bowl.
What, second bowl? Isn't that amazing? You can barely see the stitches. Hey, good boy. He's done so well.
With his tummy full, cone of shame on, Rory heads home with owner Barry to start his recovery.
Right, come on then, now you've got to get used to this.
Rory, the lovable 8-year-old Golden Retriever, has been recovering after a growth was removed from his eyelid. Today, he's back at the vet's for a checkup to see how it's getting on. And knowing Rory's big appetite for food, Amy's got a tube of liver paste on hand to keep him happily distracted while we take a closer look.
Well, Well, so Barry, how's Rory been?
Yeah, he's great. He's eating well, as you can see.
He is. He's definitely
It doesn't
enjoying
seem to trouble him, but I'm sure if we took the cone off, he'd be straight at it.
How's he coping with the cone?
Well, he doesn't like it. We don't like it either.
I was going to say, how are you coping with the cone?
Isn't it? Has he been trying to rub at the eye or anything like
No,
that?
no, not really. The only thing he does try to do is itch his ears and that.
Yeah.
And,
I think it's probably safest to leave it on another week, probably, unfortunately.
A week.
Sorry. But yes, your life will feel much simpler at the end of next week.
we'll love it, yeah.
They're dissolvable stitches, so there won't be any stitches to come out at all.
No, I'll take it, they'll
They'll
dissolve.
just dissolve
yeah.
with time. Yeah, it's really important to keep the clones nice and dry because obviously you don't want to risk any source of
obviously.
infection.
No. And we've got some like disinfectant sort of wipe stuff.
That's a good idea.
To just wipe
Yeah, we want to keep it nice and clean
especially
and dry.
after he's eaten, because he's a messy eater.
Yes.
It's not just the food, it's the slobber, isn't
It
it?
is.
Oh, poor boy.
You have to get really right and close to see what those sutures are because it's healed so nicely.
You've done a good job in that.
It's cracking job, isn't it?
Yeah.
Grapes aren't as tasty as they look.
Fern Britton Inside the Vet, brought to you by Petplan.